Good morning. My name is Claudia Martinez, Hispanic Outreach Coordinator at the Muhammad Ali Parkinson Center. And it's a real pleasure for me to be here and get the chance to share some of the strategies and approaches that have helped us to develop a successful program of services for the Hispanic Parkinson's community. The Muhammad Ali Parkinson Center is located in Phoenix, Arizona. We are a nonprofit organization dedicated to improve or maintain the quality of life of people living with Parkinson's disease and their family members. We are at the Barrow Neurological Institute, and we are also a National Parkinson Center of Excellence. And actually, it was thanks to a grant from the National Parkinson's Foundation that I was hired in 2007 to start a Hispanic outreach program. Since then, we've been able to grow the program to a whole variety of services. Most of those services that are listed on the screen due to the time limitation. And I'm going to be touching just a few of the strategies, as I said, that have helped us in the process. The first one is to avoid translating programs. What we like to do is to instead reshape programs and even program delivery, taking into consideration the specific characteristics of the Hispanic culture. A very good example is our annual patient symposium. Our Raul Izaguirre annual symposium is very different from the symposium that we have in English. We understand the concept of extended family, and we know our Hispanic patients come not only with their spouses, but with their children, grandchildren, their cousins, and so forth. So we've created 3 different tracks for not only the symposium, but our main educational events. And we have a track for the children. We have a track for the teens, led by our teen group. And we have a track for adults. And you can look at the pictures. And of course, music and food are also a very important component for our Hispanic families. Another important strategy has been to include or to kind of encourage patient and care partner participation. And this has been a really wonderful tool in order to involve active participation from patients, caregivers, and help them develop their own sense of leadership, to get them empowered, and especially to make them feel that they are part of the center, that they are partners, so that we not only build programs for patients and caregivers, but that we build programs with them. And this has been a really wonderful approach. We've used a lot of creativity, and we've used our existing programs, and we've been able to achieve not only positive patient outcomes, but also to increase Parkinson's awareness in the community. A few examples are, for example, the flyers that we use for Parkinson's Awareness Month, where we use the paintings produced by patients and caregivers in our various painting workshops. Another successful program was this painting. This was a huge painting that we did as a collective work of art that engaged the whole community at large at a Parkinson's Awareness Fair. And most recently, the active involvement and participation of all the members of our choir, Voces Unidas, and actually this is the only choir for Latinos with Parkinson's and their care partners in the US. And they've been a wonderful partners about teaching the community, the local community, about Parkinson's disease by singing a very powerful song called I Am the Beat of Another Song. That's part of a CD, DVD project that we'll be able to expand on at our roundtable, and you will be able to listen to it tomorrow at the welcoming reception. The choir performs at different locations, at different events throughout the community, and they've been capturing not only the interest of the general public, but also the media. And finally, a very important strategy or approach is to develop new programs in order to respond to unmet needs of the community. And that's the case of our Promotores program. And for those who are, of you who aren't familiar with the term promotor, it's the term in Spanish for community health worker or community volunteer. And these are people who belong to the community, who are lay people, who share not only language but culture and are able to build a bridge between the people at need and the organizations who provide services. We had a challenge, and it was to provide basic Parkinson's education to patients, Hispanic patients, and care partners who were isolated due to a variety of services. And at the same time, we had a group of committed volunteers, all of whom had a loved one with Parkinson's disease and were very active in our programs. So with them, with their help, we sat at the table, and then we design and develop an in-home education program, and also an educational tool that you can see on the screen. It's a flip chart, a PD-specific flip chart. And the most important part for us is that it was with the help of the volunteers that we developed the whole program. It was them who decided what were the 12 topics, the most important topics for them to learn to live well with Parkinson's disease based on their own personal experiences with their loved ones. So they chose these 12 topics, and each page of the flip chart develops one of these topics to be done in 1.5 hour visit for a total of 12 weeks. Is a one visit per week. And the flip chart is done in a storytelling format. It tells the story of the Ramirez family, and it's based, as I said, on their personal experiences, very simple language, and a lot of images versus text. The outcomes have been very positive, not only improving the areas of social support and communication, but also helping some of those previously isolated patients and care partners join our programs. And also the fact that these volunteers, these promotores, have become leaders, it's really wonderful because it shows their involvement and their initiative. They, after doing this for quite some time, they developed being involved in the community. They sensed that there was a huge lack of information about Parkinson's, not only in the general public, but among other promotores. And then now they're working with us in building programs and educational tools to outreach to these promotores and to the general public, increasing Parkinson's awareness. So thank you so much, and I hope that you will join me at the round table for more information on these programs.